Hey everyone, so it's Q&A Friday, so I'm just going to breeze through because we're on a clock right now. Anyway, so here we go. The first question comes from Catherine Ann. She asks, can you tell me about Rituxan Infusions, please? I start infusions on May 22nd. That's next week. So Rituxan Infusions are FDA approved mainly for rheumatoid arthritis, but failed the clinical trials actually for lupus. So I don't know why this infusion was a drug of choice if it was prescribed for lupus. Rituxan is used for those who are intolerant to more conventional treatments like NSAIDs, steroids, azathioprine, cyclophosphamide, or even Celsep. So I assume your doctor had a good reason to prescribe this. And Rituxan depletes our B cells specifically, which are overactive for lupus patients. I've never been on this, and I don't know a whole lot about the drug other than that it failed the clinical trial for treatment of kidney nephritis for lupus. But doctors use this drug, again, as I mentioned, for those who are intolerant to more of the conventional therapies for lupus. I hope that this helps. You might want to ask your doctor once again. So second question comes from Manu Demon, and she asks, how can we deal with the side effects of steroids? For example, obesity and dry eyes, right? Tell me about it. So I really highly recommend that you adopt a healthy anti-inflammatory diet, like the elimination diet under files in our group. Drink lots of water, get good rest, and incorporate exercises to build muscle because it's a highly catabolic, breaking down of the muscle kind of a drug. And also keep an open communication with your doctor to get the dose down as low and as fast as possible. If you do your part, you'll get there fast. I've always have been very proactive about tapering off the prednisone as soon as possible and vigilantly did what I could, and I've always succeeded in getting off of it sooner than my doctors anticipated. But it's my experience that doctors tend to defend the corticosteroid use and are very reluctant to decrease the dose. So you really have to keep an open communication and make sure that they look at the labs and you're able to maintain good levels before you ask them. Otherwise, they're not going to be very very willing to get you off of that, unfortunately, but fight for it. The third question comes from Holly Machowski, is I think how you say it. She asks, can you tell me if lupus causes your heart to act crazy, like blood pressure to go sky high, while heart rate goes extremely low, making one feel faint and anxious all at the same time, makes the ribs hurt severely, shortness of breath, and extremely fatigued, not being able to stay awake, but tests are normal. Tell me about it. So my answer to that is, oh my yes. Early on in my days with lupus, I didn't even know I had lupus because all the serology was normal. I had hypotension, which is very low blood pressure 1 minute and very high the other, and was extremely tired, anxious, and also depressed and severely fatigued. And this is when lupus wasn't logical, so I sought out the traditional Chinese medicine doctor, and after palpating my pulse, he said that my yin and yang energy in my heart, the fire element, with the kidneys, my water element, was in a state of imbalance. So I thought that was the best explanation that I got, because certainly my conventional medical doctors didn't have an answer for me. And I would have to take deep breaths, like as if I was gasping for air. And he said that that's because of the fundamental imbalance within me that was causing such a physiological disturbance. Could it be the high corticosteroids that I was on? Could it be something else? In truth, yes. But no one really knows exactly what effect lupus will have on different individuals. So I've learned to dance with the symptoms and focus on what I can control. That's what I eat, how I think, and my ability to exercise. And over time, I not only have great control over my disease, but also tend to be the healthiest person in the room. So please have hope. And really, the moral of everything that we talk about weekly basis is all about doing what we can do, right? We can only choose to do what we have control over. That's all we can do. But the moment we become, you know, subject to, oh, I have lupus and therefore I can't, and I'm too tired, I can't do it, you know, those are all things that are real. Believe me, I've been there. But the moment you decide, nope, I'm not going to let lupus affect the way I live my life and dictate sort of what I can or cannot do, that's a choice that we get to make, right? So that's why you're here. This is Lupus Rebel. I hope all of you guys are on the same page with me. So please, please, as we go into the weekend, stay hopeful and just be very courageous every day. So I'll see you guys next week.